would rather do it yourself, and then basically from what our attorney just said, is we would probably be, it would benefit us to do it ourselves
Well, I
instead of
think-
accept the reciprocity.
Yeah. And I think the way Ian put it is really, I think it's a good guide, because if we've done it, we've checked all the boxes, we know that, things have passed, then it just feels more comfortable to me, but,
Okay,
so.
all right.
So
We
no
agree.
reciprocity. We're going to go through the,
At this point in time, I
Okay.
think the direction is to continue
Okay.
with what we're doing. So you
and
will
once I
take them
talk to the
ourselves.
gentleman from Axis, if he's got some really valid points as to why we should do reciprocity or something, I can certainly, share those with Ian and bring it back to you all, and, if we need to discuss it further, we can do that, But having not, he was out of town for a while, and so I haven't been able, and he got back last week and I was gone, so we've been 2 ships passing in a night, so tomorrow we're supposed to talk, so I'll have more info tomorrow. So, maybe more to come, maybe not. So, we'll see. Okay. All right. Here's another CIP question. So, and Ian, I think this probably is kind of more directed to you. So, historically, through the licensing and permitting process, prior to us taking this on, the emergency manager had this. And then he did all the paperwork, then came and sat down with me, and we reviewed everything and approved everything. Then I brought it to you all as commissioners, and we approved everything, signed the license, Kim got the copies, permitting, all that done. Now, emergency manager is not part of it. We, we have it, so how does this work? Like, I sat down with Jim, he did the paperwork, and I went through it and we approved everything. Am I sitting down with myself and approving everything, or how do we do this?
I don't know that this is really laid out in the processes that we have for for the licensing, but I think that's exactly how I would envision doing it. You're going to have to fill out the application and approve it. I mean, just be sure you're going through the same processes that you make everybody else go through.
Right.
Don't cut corners just
Right.
because.
So then who pays the money for the permit and licensing? Last time, when it was under emergency management, what's that fund called?
The fund where the municipality put into it.
Yeah. There's a fund.
Well, it's not part of the current grant that we're working under. Right, but the fund, yes. Mhm. Yeah. Yeah, that's what I was thinking. We would work that out with Phaedra.
All right. So that from a legal standpoint, that's okay for me to do as though as I was the applicant filling out the paperwork, and then I make sure everything's approved, pay the fee, I come to the commissioners and show them the copies, and then they approve, same as before.
That's right.
Okay.
You just have to be sure you follow
Absolutely.
the process I did.
Mhm.
Yep.
And I mean, Laurel and I can do it together too. I mean, just so that it's, it's 2 people looking at it, not just me, so, okay. Okay, good. Thank you. All right. So that's pretty much for secure transportation. Anybody have any questions about that? Okay. Okay, so the CIP update. So we are in the process. We should be able to finalize the contract, the agreements, and hopefully get it on the agenda for you all to sign next week, okay? This is the MOU, basically the agreements between us and Cortez Fire and us and Access Health Systems, okay? So there's been a lot of communication back and forth to where we get to a point where everyone is in agreement. So I'll get back with you for sure by tomorrow, Ian, okay? So what I thought oh, sorry. Correct. Yeah. Yep.
We have reworked the agreement from last year, tweaked it and cleaned it up a little bit, so. Yeah.
Yeah. So what I thought I would do is and I know Jim Spratlin, the emergency manager, would come and do reports on CIP when he would do his reports to you. So I'd asked you all, and we're just going to do this part of our Board of Health meetings. I'm going to hit on some highlights from the reports that we get from Access, and if there's something more that you want, then we can talk about that, and I can implement that moving forward. So this actual report here is from November 1st to November 30th. And one of the goals, basically, for CIP team was to have 2 fully staffed teams that serve Montezuma County 7 days a week by December 31st of last year. As far as Access goes, they currently, and again, remember this is November, okay? Currently employs 2 full-time behavioral health professionals and 1 PRN staff. One of the full-time behavioral health professionals has completed their training that month and will be fully operational by December 1st, allowing for 7 days of coverage. So by December, they should have been providing 7 days of coverage. Cortez Fire, they interviewed and hired one of their open EMT positions in mid-November, and Cortez Fire had 2 full-time EMTs. This new EMT will be fully operational by December 1st, allowing for 7 days of coverage. So both teams should be fully staffed, providing 7 days of coverage. So, and again, this was the November report that we received in early December. So I haven't gotten December's. So we should be. I honestly don't know. So here's a question I would like to ask you all. So our role is the grant pass-through. That's our role in public health. We're not overseeing what Cortez Fire does with their staffing. We're not overseeing what Access does with their staffing. I don't know their schedule. That is not our role in this. So they provide us these reports. I can't answer those questions that you have based on these reports. So I don't have that information. So I don't know if it's more beneficial to have Access provide that, to have Cortez Fire provide that to me, and then I'm feeding it to you, or should they come and speak? I don't know. I'm just putting that out there because if you want those kinds of details, I don't have those details. So.
Well, and just to expand on that, I mean, we don't have that stuff locked into the contract as it's currently written. We
Right.
don't have strict hours of operation that
Right.
says this is when this program's going to operate.
Mm-hmm.
Now, if that's something that you guys want, I mean, that's something that we can conceivably look to write into the contract too. If you want something more firm in terms of this is when this is going to be going. As far as reports, and I think Bobby and I have talked a little bit about this, I mean, we can contractually obligate whoever we're working with to provide whatever we want them to provide. I mean, so that's the other option.
So I guess
If there's specific information that you guys want, or Bobby that you want, we can put that in the contract.
Mm-hmm.
If we're not getting what we need, and I mean, I'm not sure if we
I
are or
don't
we
know.
aren't. I'm not really sure
Well,
just from what I'm hearing, but
And we
can
do
type-
get, when they send us those reports, those summary reports, we get the, like demographics, for instance. of who was seen, and the demographics are, you know, race, age, ethnicity, all that stuff. And then we get some clinical issues as far as, and they're all bar graphs to give you an idea of numbers seen. None of this reflects staffing or hours. So I
thought the MOUs addressed the staffing and the hours. Because when we first set this up, it was, we didn't have the dollar value to do 7 days a week. And I think we did it 5 days a week, correct?
I think so.
And then so now if we have the staffing to do 7 days a week, still, what are the hours of operation? Because when this was first presented to us, we had, they gave us their busiest times, and then they tailored it kind of like, I'm going to pick a number, 10 o'clock, but don't use that, till 7 o'clock in the evening, and it could be different. But what hours of operation, I mean, I would personally like to know, what are we covering 7 days a week?
Well, and so the original contract, I know that there were some discussions about staff time and when the CIP van was going to be operating, but that was not in the contract.
They're working 8:30 to 8, 7 days a week. 11.5-hour shifts right now, yeah.
So if you guys, is that something that you guys want to see in that contract? I mean, you kind of got to weigh it both ways because, I mean, you've got a contractor that's providing services. I mean, if you want specific hours in there, then that's something we can put in there. That's not in there right now. I think there's advantages and disadvantages to putting it in versus not putting it in because, I mean, the advantage is you've got something very set and very concrete. The disadvantage is with a program like this, I mean, there may be certain times that they might want to work longer shift. I mean, you see what I'm saying? I mean, how much flexibility do you want to give the provider is what it really comes down to.
Running like 10 to 6 and assistants being able to go 8:30 to 8 versus them having flexibility to cover more time has been great. And then, there are other variables that come into play. If we're training someone, if somebody's out.
What I can say about the contract as it's currently written, and this was the way that we signed it when it was first brought in. It's a loose contract. It is not
Right.
not strictly construed. It does not have super strict requirements. I mean, that's the way that this
So-
thing's written. And so, if you guys want it done a different way, we can do that. I mean, we can make this thing very specific, very closely tailored, lock it in. That's an option. I mean, it just really comes down to what this board wants, what Board of Health wants, what Access wants. I'm no expert on how to run a CIP program. I mean, I simply,
Well,
I mean,
none-
that's
none of
beyond
us
my
are.
purview,
I think
so.
we were using historical data from programs that we're running, which are very new.
It's all
and
new.
we tried to tailor it to the best of our ability to what was presented to us. So it was, nobody has 100% perfect world. So I think what I just heard from our attorney is to leave it really gray. Is that what I got?
And you're.
I don't love
Bill-
gray area contracts, I mean, quite frankly, and I think, but, if
Just
if
messing
that's,
with you.
I know. We've got the contract done at this point. I mean, we can put it on next Monday's workshop. You guys can look at it and see if the terms line up with what it is that you want. And, Bobby certainly could be a part of that conversation. I mean, I've gone back and forth with Access's attorneys. We've got the legal stuff dialed in. I mean, now really it's just a matter of terms. And, I mean, that's not my purview.
I think it. I feel like it's on both parts. I see both sides of it, because if we dial it in too much, and you lose staff, you're not going to be able to deliver, and then you're in violation of the contract. So that's the problem with dialing it in too much. And some of the changes that we made was, we did say a minimum of 5 days a week rather than 7 days a week, because the contract did say 7 days a week, and we had not done it until December. So that's why we have a minimum of 5 days a week. So that way we can go to 7 days a week. And it's great if we can have the staffing to do that, But the hours of operation, again, I think, that's not our role. I'm trying to stay in our role as public health with this contract. So that's not our role to decide that. I think it's the organization is providing the services role to figure that out. But I do think one thing that I would like to be able to say or see is long-term impact. I don't know how we see long-term impact, and that's something that I wonder, what is the long-term impact of the folks that we have helped with CIP? What's the distribution? Where, are they continuing on a continuum of care? Have they dropped off? Those types of things. To me, being in public health, that's kind of like, I'm interested in that. I don't see that from the reports that we get from CIP, from Access, but is it too soon for those things? I don't know, So
what, and I may not be able to answer this, but what created us to extend those hours of operation and or the 7 days a week? I mean, are we seeing that many more calls? I mean, what made that decision? What was the driver? What was the math that showed me?
I think that was the original goal, wasn't it?
Yeah, that was the goal for the program. I think, utilization and referrals to the program has gone up. They self-dispatch to do follow-up. So they're going out and making a ton of calls on their own and doing follow-up with a lot of the individuals that either come in through 911 or come in through the referrals. So they really were taking it upon themselves to do more. And that's how we got to 11 and a half as well. I mean, we have to tell them that they have to go home sometimes, because they would work all the time and come in early and stay after. You have a pretty motivated group on the team. So 11 and a half has worked really well on our other co-responder programs. So I think that's why they went to that standard shift, and it aligns with what fire's doing. So I think there's always, opportunity to refine it. More than that, I think, would be tricky. So yeah, if they can cover 7 days, we're in good shape right now. But yeah, long-term impact, I think a lot of different agencies are trying to figure out what is the way to figure out community impact, like using sort of a negative algorithm, like how much money are you saving the hospital, emergency services. It's hard to track
Right.
what's been avoided. We've asked a lot of people if anybody will share their methodology. No one's figured it out perfectly yet. So a lot of it's ballparking, it's saving the system X amount of dollars. But yeah, I agree. I wish we had a better way to look at long-term impact, but we do have a lot of anecdotal information from the team about successes.
So I would think that would be valuable, even if it is like anecdotal information, like if that can be compiled, like even just on a yearly basis. Like we're into our second year of doing this, right? CIP?
Yeah.
Okay. So, we'll have the first year, and then we'll have this year with having two teams, essentially, There's going to be, even when I look at the numbers, the numbers of encounters in November, the initial call was 28 and total calls was 60. And in October, it was 27 and 61. Now we have two teams 7 days a week operational. So all those numbers are going to go up. So I think it's worth formulating some sort of data to document what, especially if we've grown it, what the impact is. I think it would be good to have some sort of report after the end of the year to see what impact we think has occurred, and are people consistently being followed, or are they dropping off? Like when you said that they do that on their own, that they do their follow-up, that's tracked though, right? I mean, they're
Yeah.
not just, right, so they're recording that they're going out and doing,
Oh, yeah, because they have to call it in.
Right.
Yeah.
So I think that would be valuable information, especially when it's time to report out on this to the funders. And if we're continuing to want to fund this, I think we're going to have to show that, I think,
Yeah, just let us know what you want us to answer, because we keep that information.
Well, whatever you think would be valuable, I think that we should pull it together, because, I would think you all would want to know that too, like what kind of impact this is having. Because if we're just spinning our wheels, I don't know, if it's something to continue.
And so if anybody has specific ideas as to what kind of deliverables they would like to see, shoot those to me, and we'll get it in the contract. That makes a ton of sense, to get something concrete in a contract so we have specific deliverables that we can look at. I don't know what those deliverables would be, but I can certainly come up with a couple ideas just off the top of my head as a citizen, what I would want to see. But let's talk, Bobby, and certainly the board too. You guys are more than welcome to shoot me a call or an email or whatever if you have certain deliverables that you want to see.
Dr. Mullen, looks like you.
Should probably be coming from the providers, because it's a newer program and we don't have exact metrics that we need to meet with this
You send
program.
us the original contract.
I can. Yeah.
Okay.
Yep.
Yeah, I'm not sure what's happening with our connectivity. Yeah, I think, so are we looking at trying to make those adjustments for this contract right here? Ideally,
Seems like we've
should.
got a whole year ahead of us. It makes sense to
collect
dial
the
it in
data.
right
I know,
now.
I know.
I
That would be my,
think it's.
yeah,
I think it's very valuable.
right,
But
okay.
We just have to see what we can track within our system. That we're just going to have those limitations. So, other than our dashboard, which you all have seen.
Right, and that's good information, but that's not at all giving an idea of what the long-term, I don't see anything that represents long-term impact in any of these numbers. So that's kind of what, I think, that's the meat of why we're doing what we're doing. Go ahead.
Would it be easy for y'all to pull a list of what you already track and maybe give us multiple choice of things we'd like to see? Right? Just things that are, I don't know which
Yeah, 'cause
EMR
right
y'all are
now-
on or what you're tracking already.
Yeah, it's more of, it's the long term that we'll have to figure out. So, yeah, I just don't know what capabilities we have in terms of seeing, like following someone through our system with our current tracking, if that makes sense. That makes sense. Yeah.
'Cause it's
It might
whether
be
they-
like a change in like a PHQ-9 or something, like that would be something, but everything else would be individual. So just kind of processing what it would look like.
The number of follow-ups would be helpful, because that would be easy to track. We saw this person 5 times since their original call, and they've now established with access. Like that would be, and that should
Yeah. Yeah, I'll talk to our reports team and just see what we can flesh out.
see what y'all are already doing too. If you're already
Yeah.
doing the work, like, I hate to
Yeah, because there's quite
add
a,
something on.
we have a lot of information, and just seeing like the change over time and what sort of things that they're doing has been interesting. Originally a lot of the calls started as substance use related, and then as law enforcement became more knowledgeable and the team was helping more, like you can see the shift in the clinical issues, the disposition, and the type of intervention. So like everybody's getting more training, becoming better at this, you can see the shift in time just to what's being called in, which has been interesting to see. And we've seen the same things happen in the other communities that we have these programs, like start as one thing, and then over time have completely flip-flopped because people have, more training and knowledge to identify, like, oh, maybe this is a mental health issue that's related to a chronic condition. It just changes how they call it in.
I think that, I don't think any of us really realized how much case management that this program really is. I mean, it's a lot of case management after that initial contact, and then all that follow-up is case management with folks, and I think that was a different direction than we originally thought it would be when it started, so.
Yeah, and lots of rapport building too. They're just going and seeing if they can make the connection, and it's the 6th or the 11th time that they're finally like, okay, Charlie, I will do what you suggested. So a lot of it's that kind of stuff too.
But that to me is valuable information, because if it took 6 or 11 times, at least we made that shift, and they're willing to take it to the next level. And it does take a while to make change, right?
Yeah.
So, but I think that kind of stuff is valuable information. So the one thing that was in this report also, that it's unduplicated numbers of people to be served, and 240 was the goal, and in October they were at 238, and in the November report they were at 255, so they had already exceeded their goal in November, so it's just going to be even more than that. So, as far as unduplicated services. So I mean, clearly people are being reached by the CIP program. And again, I just go back to that, to the long-term impact, what changes are being made in their lives, So anyway, okay, so more to be talked about on the CIP. So any other questions about the CIP report? Okay. So just to kind of give you a little update. Thanks, Haley. Appreciate it. For WIC, I had spoken to you all a little bit about what changes were coming down from the WIC standpoint. So there's been a lot of conversation, a lot of work put into this between CalFO, who is the organization of the directors throughout Colorado, local public health agencies, and CDPHE leadership. Lots of conversations. They have made some changes in the plan, and I think they're for the better, because they're taking away that 2,000 number that you had to achieve 2,000 clients in order to consider yourself to be a site. The partnership option is 100% optional now, so you don't have to. Okay. Okay. So the partnership doesn't have to be. It's not. It's an optional thing. So what they're going to do is they're going to have work groups. So one of the work groups is a funding model work group, which is going to consist of leadership, LPHA leadership. A lot of WIC programs are not in public health around the state. So those folks are not represented by CalFO and the leadership at different levels. So their input is just as valuable as all of ours. So they're being brought into this as well. Service standards is the other work group, and that's going to include WIC staff. So what they're trying to decide is how these work groups are going to be structured. They want to get the rural voice, they want to get the urban voice, they want to get the non-public health voices, they want to, they have to get pieces of everybody to be part of these work groups. They're working on how they're going to come up with that format, okay? However we here in Montezuma can participate, we're going to participate. I'm hopeful that we'll get on both of these work groups, because we've been a pretty long-standing, successful WIC program. So I think that our input would be valuable, but I'm sure every other WIC agency feels that too. So we'll do what we can to be part of the work groups. what they're saying is that you have to be able to meet service standards, and they have a whole set of service standards. Most of those service standards we already do in our department. There's a couple nuances that might be a little challenging, but I think we can work it, and that's part of these work group sessions. And they are going to start supposedly soon and run clear through September of this year. So it's still a work in progress, but I think we're better off than where we were. And when I asked about the RFA, they didn't say it wasn't going to happen, but they didn't say it was going to happen, where we had to apply to be a WIC site. I don't know if that's, because that's supposed to be released in March or something, and there's no way that's going to happen when your work groups aren't even going to be finished till September. So we'll see how this plays out. So
Talking 2025.
maybe, yeah. So there will be changes, but I don't think it's going to be as dramatic and as hard-hitting as it initially felt. So, and it was due to a lot of people speaking up and a lot of people, being very vocal about how this was going to negatively impact our communities. So, I think that's, anything else that we need to say about the WIC thing? That you can think of?
Now we're going to be able to hire because they're going to have a longer time.
Yes, so that was kind of our point, our tipping point of, I didn't want to replace Linda if the program was going to be at risk. I didn't want to hire somebody saying, you don't have a job for I don't know how long. I mean, I'm not going to do that. So we're in a better position now. We are going to proceed, and because we really need, Delilah needs help in WIC. We have far too many, 600 and some families. She can't do it herself. So we're going to hire another educator to help her out with that. So hopefully we'll get that posted this week and be able to move forward with hiring that position. Any other questions about WIC? Okay. All right. So that takes us to our retail food. And on the agenda, I put notification of violation. And we have Linda Hill here. She is our new program manager for environmental health. And I will just kind of hand this over to Linda, but I will start by saying the notification of violation, we are at a point where we don't necessarily have to discuss this specific notification of violation that was delivered, because I think we are in a position where we're working through it. But it gives us the option right now of kind of talking about the processes of where we go when we have something like this be brought to us, that something doesn't look right out in the community and we need to address it. So go ahead, Linda.
Shortly after I started, several people contacted me because there was an individual on Facebook running a retail food business. And so I reached out to the individual. I called her, left her a voicemail, I emailed her, and she didn't respond. I emailed her again. She did respond to one email, but not to satisfy what, I was asking this person to apply for a retail food license and go through the process. And when I said that again for the second time, she just ghosted me. And so I reached out to my state contact and was asking him, like, okay, what's the process? I'm like brand new. And so the process is you send one letter, the first letter, which is you state the statutes that they're violating, and you're like, you need to apply for a license and pay the fee and go through the process and this and that. We had that served by a sheriff's deputy, so they served this individual. And the good news is, at least from a Facebook perspective, this person is no longer running this business. So I took that as a positive. Now I am on a weekly basis going on Facebook just to make sure that this person is still silent. So just so that you know how this whole process worked, if she hadn't stopped, then There's letter 1 that gets served that just says cease and desist, here's the statutes of what you're violating, and please be in contact with us with your license, your application. And if that person continues to do what they're doing without applying, letter number 2 actually has like an actual hard and fast date. It's like a 14-day thing that says, okay, you have 14 days, and after 14 days, if they're still operating illegally, then letter 3 is cease and desist. And so that's kind of how the process works. I don't know if you have questions about it or if you agree with it or want to do something different. I should back up and say, with letter 1, I talked with both Bobby and Laurel about it. We also included Ian on the review of the letter, just so that we were all, and we copied Ian and we copied my state person, and Bobby got a copy of it as well. So, and we would do that with all 3 letters.
And we really are, we just want to communicate with people, and we want to educate them so that they're just kind of following the rules so we don't have an illness, okay? They could be totally prevented. That's all this is. So, if we get communication, that's where it, can end as well. It doesn't have to go to letter 2 and letter 3 if they're working with us, right? So it's more if we get someone who's like ignoring us, ignoring the fact that we want to work with them and communicate with them, that's when that sort of triggers the process of that, second letter. And then
I
the
also,
third letter.
when I emailed her before the letter was issued, I, told this person that I look forward to working with you. Because, a lot of people, if they feel like they're backed in the corner, I don't want to, spawn that on. I want to, this is a partnership. We all in the county work together. And so I went at it with that spirit.
Does that process, the first letter, because we didn't get any response, that's the only reason that person got that letter, was because we were getting no reply and multiple attempts. So,
And continued activity on Facebook.
so I think that what I want to know is that are you all good with that process of the first letter being served, then the second letter, and then the third letter, and of course we would bring it to the commission at that point.
Well, I think so. I mean, it was more than appropriate to reach out to this person first, trying to work with them.
Yep.
And to be ignored, and I think the process is working really good.
Yeah. And plus this individual also was violating a zoning issue. I also included Don Haley just so that he would know, because he actually was one of the people to let me know what was going on and that it was a zoning violation. So, I mean, I feel like we did very well all communicating with each other and trying to reach this individual.
Be careful with that, though. Zoning and food violations are 2 different things. Don't lump them together. Let the zoning department do what they do.
Yes,
You
and-
guys do what you do.
And we did. It's just Don Haley just said, hey, would you mind, on a side note? I led from the environmental health perspective, and I did encourage this person to contact Don directly for the zoning.
Again, just be very careful.
With that,
Zoning has to do what
their
they
own-
do.
their
You
own-
guys do what you do.
Okay.
Don't lump those 2 things together because
So keep them separate?
Yeah, because yeah.
Okay.
Keep them separate.
Okay, thank you.
That, it's not always situations like that. A lot of times, these kind of things are brought to our attention by retail food vendors that are doing what they're supposed to be doing every year, following the rules, paying their retail license, and then they see this happening out in whatever social media world or whatever, and they let us know, like, hey, I'm playing by the rules. How come this person's getting away with that? That's where a lot of this information comes from too.
And we don't take that as gospel. We do our own reaching out to the individual. Somebody issues a complaint or a concern to us, we contact, they have to give us the name of the person that they have issue with and the phone number, and then we contact that person. We have conversation. Oftentimes, it's just they weren't aware, and they come in and do what they're supposed to do, and it's not a problem. But it's the other that, and it doesn't happen very often, but once we get a complaint, we need to act upon it, and we usually start with whoever the potential person is that's violating.
Like the process is working pretty well right now. Obviously, contacting them is the first thing, and then progressing with the letters and up until the point of, you know, we have to do what we have to do. So I guess to answer your question, I don't have any issue with it. I think, you know, obviously Kent has more.
I mean, for us not to contact them would be a disservice to everybody else
Right,
that has those licenses.
right,
Well, we're just trying to, I mean, it's all about making the playing field level
right.
Yeah.
for everybody and to make sure that everything is complying with the health.
And ultimately, I mean, it's about health. It's not about collecting fees and stuff. It's about health of our county. And if this is preventable, we definitely want to be on it, you know, so.
So no, I'm good with the process.
Okay.
Yeah.
All right, well, thank you. I don't have anything else on the agenda. Do any of you have anything you want to bring to us? Okay. Suggestions for our next meeting? In April?
So the last test that I took, the new required Board of Health training
Yeah,
by the state, I took module 2, I think.
okay,
One of those sleepless nights, I couldn't sleep, so I get up
yes.
and
I remember
take a
you
4-hour
saying that.
test. They don't tell you it's going to be, well, I think they did tell me it was going to be 4 hours, but. When is that next one coming out? And is that, did you guys have any idea, or is that?
No, I
one a
usually just get an
year, or-
email that says, our commissioners have been sent this email, and they need to do this training, and I don't know when it's coming again. But it's supposed to be annual. It is an annual thing that you're supposed to do that training online. So. Did you do yours, Commissioner Lindsay?
No, I did not. Cheryl just gave me the look.
I know. Commissioner Copenhaver has done his from the beginning.
These
He's
guys-
an A+ student.
These guys sleep well at night. I'm the one that's up.
And I did the,
This morning?
I didn't do this most recent one, but I did the one that Commissioner Copenhaver did when he got in. And, I mean, I think there's some valuable information in there. I do. As far as what a Board of Health is, it gives you the history of, pieces of public health and stuff. So I'm assuming they are going to update it each year. If it's something that you need to do annually, I would think that there's going to be updates, but I don't know. So that's the state's put all that together. So,
Okay. That was. Well, yeah, it was, well, because you had to watch all the videos.
Oh, you couldn't stop once you started.
Oh, trust me, I learned real quick how to do that. I didn't say it took me that long to take the test. I said it is a 4-hour test. And I passed it.
do you have any ideas for what you want us to talk about in April or bring to the board? Anything that
Yeah, I'd
comes to
like-
mind?
I'd
Huh?
like to see,
Ticks. Okay. Ticks.
It's his ticks and mold.
Yeah.
Oh my goodness. That's,
Virginia, there's so many ticks and mold in Virginia. I'm so used
yeah.
to
we
it.
don't
Here
have
There's
those
not.
things here.
I know,
No.
it's
Either
why
one
I
of
lived
them.
here.
It's a dry
My patients
climate.
think that- Yeah, I know, my patients think they're
I-
everywhere.
I guess I'm not familiar with you're saying they're coming out of Mexico?
Yeah, well, it affects cattle more than humans, but they think it might cross over. And it's a killer for cattle. I don't know, it's a long tick? Is that what it is?
This was called long tick?
Yeah.
Okay.
Yeah, a lot of referrals to it is a Texas long tick.
Okay. Yeah.
I'd
should
just
be
like to see
interesting.
Linda back.
Yeah.
Just,
Yeah.
Let's see if she's still here.
I'm not ordering anything on Facebook, that's for sure.
Oh, goodness. All right. Well, were you
I
going to say
really
something?
don't. I don't have anything right now.
Okay.
No, but if I do, I'll let you know.
Yeah, by April, we
Great.
might be in tick season, you never know. Well,
Now,
not
if
so
that
much
comes
more.
to fruition, I'm going to blame you.
Hey, my wife had tick fever.
Oh, did she?
Yes.
Here? From
Yes.
here?
Uh-huh. My cousin had tick fever.
Here.
Yes.
Wow.
Commissioner Hertel had it. And all it takes is one of them nasty little boogers to walk across you and you get sick.
You know, you know what's crazy is my dad had it when I was a little kid. He had it. And, you know, he spent about, I'm going to say, a week in the hospital
Yeah.
here. And he smoked and stuff his whole life. And when he got through with that week, and of course back then all the nurses and everybody, they all smoked. When he got through with that week there,
Especially
he
the
could
doctors.
not stand it. He could not stand the smell of somebody when they were smoking. I don't know what it did to him, but he never smoked again, and he could not stand to be around people that smoked or in a car with somebody that did. I mean, it was really and he would tell you, he said, I don't know what that did to me, but I cannot stand that stuff anymore. And he smoked his whole life before that, as far as I know.
That's one way of quitting, but not one that I would
I mean,
recommend.
It was a really good thing for that. but
Wow.
I don't know
Well, we
what
could
that had
introduce
to do
ticks
with
for
it, but
cessation, could we?
he-
I don't know.
Yeah.
Gosh.
He flat could not stand to be around somebody smoking after that. I mean, he would just get up and leave,
Oh, yeah.
you know, because he just, I don't know what that did to him, but it was probably a really good thing.
Okay, well, thank you all for meeting today and for the feedback on all the topics we talked about. And more to come on our contract for the CIPE. And we will meet again April 2nd as a Board of Health. Thank you.